Proper training for the next generation is crucial if we're going to have a workforce that can manage and support people.
Have to continually train and educate our healthcare community so that they can deliver the most effective care.
There are immense challenges for health and social care in order to be able to gear ourselves up to the challenges of care in the future. People with dementia and the families that care for them often feel abandoned by services. What that means is that they tend to come to services when it's too late to avoid crises. The Time for Dementia programme aims to change entirely the way that the doctors and nurses of the future deal with people with dementia.
Hi, is it Brenda?
It is. Is that Libby?
Yes.
Pairs of students will be introduced to families of people with dementia in their first year and will follow them through for the whole of their course. So for medical students, they will get to know that family over 4 years, and that will give them a unique insight into what it is to have dementia.
An award you're wearing around your neck?
That's the ex-mayor. No, was I?
It was really nice to meet Brenda and Jim and get to know their life story, which will help me as a student nurse to give the best care that I can.
I want the new initiative with the new generation of doctors and nurses to support the patient and to ensure the person is always at the centre of what they're doing.
The KMSS 111 service is currently taking 100,000 calls a month. The clinicians are providing an absolutely critical role in the management of these calls.
My colleague said that you've had some bleeding.
The specialist practice programme is a fantastic thing in terms of patient care and also making sure that patients are sent to the right place the first time and to reduce the burden on the wider NHS.
Ultimately, some things we may be able to sort out over the telephone and they won't need to contact their GP or go to hospital, so it's going to be a better journey for the patient as well.
Training is absolutely fundamental to everything the clinician does. So by using this initiative, we're making sure that we're saving ambulances for those with the greatest need.
Just come towards me a little bit. Well done, Zara. So I'm just going to hold your ear.
The practice nurses are critical to the functioning of the GP services, and there is a huge shortfall. So anything that can be done to encourage nurses to come into the profession has to be a good thing. Okay? How was that?
As GPs, we don't have time to be able to spend long appointments with patients looking after them on a routine basis, sorting out their chronic illnesses. And this is something that practice nursing has developed very well.
This initiative is fantastic. It's the first opportunity to get student nurses into general practice. They'll be exposed to how the general practice system works, but also be mentored by really experienced practice nurses. I would hope that this would result in nurses coming into general practice to be our workforce for the future.
This project's really important because it reduces health inequalities through targeting the ageing population with chronic diseases.
Open for me.
They have a risk of decay, discomfort, ulceration in the mouth, and there's a risk of pneumonia. At night time, we want to either leave the dentures dry or just leave them in cold water. One of the dental team showed them how to actually examine the mouth and have a look for any lumps or swellings, and then how to look at the teeth and take the dentures out if any exist, and then clean the dentures.
This training, it was really fantastic and I enjoyed it. It was really useful for me.
Thank you very much, Dougie. The way in which we've structured the training has been similar to that we've structured for other dental professionals, so that's been a nice aspect of it, and it's brought them closer to the health community.
Pregnancy is a very happy time for most people. Sadly, sometimes things don't go smoothly. Simple things came out from the film. The importance of listening to people.
But even to take 5 minutes and just hear what it's like for the parents, what they're experiencing or what's important to them.
This is something that we need to share with everyone.
If we don't continually develop our healthcare teams, we're not going to be able to impart the most recent knowledge and skills to them.
We have big challenges ahead with a growing population. If we provide the right training, then we can meet these challenges and provide care where people want it.